Outpatient pediatric appointments typically fall into two major categories. One category is the acute care visits for acute problems, and the other type, which we'll be covering in this lecture, is the well-child visit. You probably remember going to these when you were a child, and this video is intended just to give you a good overview of what to expect during the first well-child visit that you're going to be observing. In general, think of these well-child visits as periodic check-ins. I've listed down below the times in which children do go for these well-child visits. Now, at these points, parents can not only ask questions about their child's developments, but it's a good time for physicians to impart information about normal development, nutrition, sleep, safety, and make sure that children are growing up in a healthy environment. Now, because pediatricians oftentimes follow many of their patients from newborn till 18 years old, they tend to build rapport as well as get to know details about the child's likes and dislikes as they grow older. My preceptor, for example, had an uncanny memory for remembering at the end of the day. I forgot to mention in my note that his 8 a.m. patient's favorite juice was apple juice and his 3 p.m. patient's favorite color was red. You know, a little exaggeration there, but the point being that non-medical details may be just as important. I'm going to pattern this talk after how you might write up your note in SOAP format, which you should all be familiar with. First is the subjective. This is the longest portion of the exam. These patients are healthy, so there will be very few labs. One way to start off these well-child checks is to ask the parent what concerns they may need addressed at this visit. Next, ask about interval medical history. Has the child had any hospitalizations, surgeries, new medical conditions since their last well-child visit? The next big chunk is assessing development. If the patient is less than 6 years old, use the beloved milestone markers to determine whether the child is at the correct gross motor, fine motor, social, communication milestones for their age. This is actually a lot easier than you think. You want to watch the child move about the room. Are they crawling, walking, trying to walk? Alternatively, ask the older children, for example the 4-year-old, to hop on one foot. Let the 4 to 6-year-olds use your pen and have them draw a person on the back of a piece of paper. One of my preceptors told me that children should be roughly able to draw a person with at least the same amount of body parts or features that correlate with their age. So the 4-year-old should be able to draw at least a head with a body and 2 feet. Communication can be easily assessed by talking to the patient or observing them interact with their parents. Social skills can be elicited by asking the parent or even just talking to the 5-year-old and seeing who their best friend is. Now, after this history, you want to take a history of the diet. Are they a picky eater? Do they appear to be eating fruits and vegetables? Are they drinking milk? Are they drinking too much milk? Do they drink juice? For which any juice was too much for my preceptor. And this, of course, is important, especially in the overweight or obese children, to make recommendations for parents as to what they can do. Next, ask about sleep patterns. Are they sleeping on their own? Do they spend the night in their parents' bed? If so, does this actually bother the parents? Do they have frequent nightmares, instances of sleepwalking? And if they do, are there any hazards around the room that need to be taken care of? Going along with this, are there other safety issues relevant to the child's age? Are they living in an old house where lead poisoning is a potential problem? Elimination patterns. Are they potty trained? Do they move their bowels on a regular basis? Are they wetting the bed? Next, ask them if they're brushing their teeth. Are they getting enough fluoride? You know, I was working in a place where many of the children lived in houses that used well water as a main source, which actually meant they needed to take fluoride supplements. Now finally, ask about some social history. Where are they living? Who are they living with? Do they get along with their siblings? Is there anyone that smokes at home? How are they doing at daycare, at school? Who their best friends are? Are they making friends? You know, are they getting into trouble, getting straight A's? What are their favorite pastimes, favorite toys to play with? Do they have a lot of opportunities to exercise? And again, this is all important from a medical point of view, but also for rapport building. And for patients greater than 14 years old, the HEADS questions should be covered, which I've listed below. These are definitely worth knowing for the wards, as I have been pimped on this. Again, a lot of this is very self-explanatory and common sense sounding, and I promise you, as you do more of these well-child checks, it'll be pretty easy to remember what to ask. After the long subjective portion, objective is next. As you might guess, look at the vital signs. Chart the patient's height and weight on growth charts, and potentially discuss this with the parent at this point. Think about whether hearing or vision screenings need to be performed, and do a full physical examination thinking about particular areas related to the patient's age. For example, hip examination in those less than 12 months, cover-no-cover test for strabismus in those less than 6 years, scoliosis for greater than 6 years, hepatosplenomegaly or abdominal masses in all ages, and Tanner staging in greater than 8 years old. Screening labs, if they are done, are likely to include maybe a hemoglobin or a lead level. You might want to remember to include labs for newly diagnosed or established medical problems. And now for the assessment and plan portion of the visit. This, of course, does not have to be in any order as long as all the parts are there. So address any acute issues the parent or patient brought up, discuss any anticipatory guideline measures that need to be taken, such as fluoride, safety problems, lead, go over the vaccine schedule, think about whether the patient needs screening tests, and finally, let the parent know how the child's general health is with regards to growth based on the health charts, development, and nutrition, and discuss any red flags that you might have picked up during the visit. And now for the take-home points. As this was mainly an overview, these will also be very general. So first, pre-write the template of the interval development. You won't forget the categories, and you'll look great when you're presenting. Second, much of the developmental milestones can be determined through observation. And third, structure your well child checks as if you were writing an extended SOAP note, and use the outlines presented here to guide you. Thanks, and good luck.